This segment of DelmarvaLife is brought to you by TidalHealth.
It cannot be overstated how important it is for individuals and families to have a primary care provider they can rely on in times of sickness, injury, everything else, including your basic checkups. Being able to get quality and friendly health care, it's absolutely invaluable these days.
Yeah, things change quickly in the healthcare landscape, and TidalHealth is working extra hard to make sure those changes are for the better, including expanding access to primary care providers. And we're here today with Jennifer Ketterman. She is the Administrative Director of Primary Care with TidalHealth. Jennifer, thank you for coming in and being with us.
Thank you for having me.
Let's start off by mentioning TidalHealth has been rebuilding in leadership after losing some primary care providers over the last couple of years. What sets TidalHealth primary care apart?
I think one of the biggest things is that our TidalHealth offices expand over 5 counties, so we have a presence over the Delmarva Peninsula, and with that we have a large footprint on the peninsula, so we are integrated in multiple communities. We obviously are integrated with both hospitals at Nanticoke and in Salisbury, and I think that allows us to provide access to patients where they are, right, and provide quality care all across the peninsula.
So let me ask you this, and help me if I phrase this incorrectly. It seems like when it comes to patients, you've got treatment because something's happened, or you've got preventative care to try to avoid something that's happened. Where does TidalHealth place the preventative care part?
A lot of times we incorporate it into every visit. Yeah. So even if you come in for a sick visit, we have a piece in our electronic health record called Care Gaps, mm-hmm, and that reminds the provider, even if you're there for a sinus infection, if you're due for preventive care, we can address that while you're there, even, yeah, for your sick visit. So we've kind of incorporated it into every single visit.
You know, you go to a doctor sometimes and you want that doctor to be only concentrating on you, listening to you. And sometimes, and some people feel like they might get lost in the shuffle, but that doesn't happen at TidalHealth. How do you keep that patient-centered service?
I think the biggest thing that we do, all of our providers, we have excellent providers across primary care and with our specialties. And I think it's just developing relationships, especially with primary care providers. You develop a relationship that lasts potentially the whole lifespan. So you can see a provider when you're a child, keep that same provider as you get older into adult life.
That relationship is huge. It's important, and TidalHealth has a way to keep that communication going. Mm-hmm. Tell me about that.
So we have lots of opportunities for communication. One of the big things that we utilize and we encourage more utilization of is MyChart, mm-hmm, which is our patient portal. And it's kind of like email within your chart. So you can message your provider, they can read your message, you can request refills, you can ask questions. It can be 10 o'clock at night or 3 o'clock in the morning if you wake up and have a question. And then the provider can respond directly to you, and it opens that two-way communication pretty much all hours, yeah, of the day and there. Night. Yeah. Yes.
You know, a big complaint from patient relates to physician availability. What can new patients expect as far as wait times whenever they sign on with a primary care physician?
So we have, over the last year, we've recruited many primary care providers across our offices, and we have availability in almost every office for a new patient appointment within 2 weeks. Opportunities to schedule that appointment is you can go to TidalHealth.org. You can directly schedule through our website in many cases. You can contact the offices from the phone numbers on our website and call to schedule the appointment. And you can usually be seen within 2 weeks in many of our offices.
That's great. That's wonderful.
That is good. That is very good.
Jennifer, thank you so much for coming in today and talking about primary providers through TidalHealth.
Yes, thank you.